Hello, this is Neil Baum from New Orleans, and I would like to speak with you for about 7 or 8 minutes on the importance of efficiency. This is going to be the first of a two-part article on improving the efficiency of your practice, and I've titled the program Getting Home for Dinner, and I'll explain that as we look at the next slide. So what is this program will cover? It will cover the current problem regarding efficiency in most urologic practices. And I'll give you 5 suggestions in this first of the two-part series for improving your efficiency. And hopefully, as a result of trying a few of these ideas, you too can get home for dinner. The current problem today in most urologic practices, we see a decrease in reimbursements, a rising overhead. There's a decrease in income for urologists. And unfortunately, we are working so hard that we often miss dinner with our families. So what are some of the solutions? Well, needless to say, we're not going to be able to significantly impact or increase reimbursements. We can try to work harder and increase productivity. We can try to decrease overhead costs. But one of the circumstances that we do have control over is to improve the efficiency of our practice. So number 1, improve the efficiency by being labeled or being called an on-time physician. There is no better way to improve your efficiency by being on time, and no better way to torpedo or ruin your schedule by being significantly delayed. To be an on-time physician, it's imperative that you start on time. If the start time is 9 o'clock, it's not going to work with the schedule to arrive at 9:30, check emails, and return a few phone calls. We have to have our staff put the patients in the exam room 10 to 15 minutes before the start of the day. Also, tell the patients that you are going to see them on time, and they will arrive 15 to 20 minutes earlier so they can be put in the exam room on time. Next, let patients know about any delays that are taking place. Have somebody walk out into the reception area and give them an explanation. You can also use your website to update patients. This is an example of my website where it's updated. Certainly, if there are going to be delays, we update the website, letting the patients know about the delays. So my take-home message on time is that patients are going to be willing to pay for outstanding care, but they don't want to wait for it. And we can be more sensitive to the time of our patients. Second, use videos to improve your efficiency. There are many times during the day that we say things multiple times over and over again. These sort of topics can be placed on videos that you can create yourself that will educate patients and not requiring your time. Some of the topics that are applicable for urologists are shown in the next slide. And one of my favorites, or the one that I use most frequently, was for vasectomy. I often did 4 or 5 vasectomies on a Friday afternoon, and I wanted to have all the information on a video describing the procedures, the risks, the complications, the importance of 2 semen analyses after the procedure. The equipment you need for making these videos, it can be done with an iPhone. You have a tripod with a wireless remote, and you have to create a script. The script is the same for every video, almost every video, where you describe the topic, why it is important to the patient's health, what are the risks and complications, what are the alternatives for the treatment or the procedure. And every video ends with, I will return to the room after you have completed the video to answer any questions that you may have and provide the patient with a written summary of the video. This has been invaluable for improving the efficiency within the practice. You can show the videos on your electronic medical record. These videos can be downloaded to YouTube. I have nearly 100 videos on YouTube where I created 1 to 2 videos a month, and it was amazing how many additional patients I got from the videos that were on YouTube. The advantages of the video is certainly improves efficiency, because while the patient is watching the video, you can see 2, sometimes 3 additional patients while they're watching the video. You can demonstrate that the patient understood the material by asking them to complete a true-false questionnaire at the end of the video, and to make sure that they understood what was on the video, making good medical legal protection for you, that the patient clearly understood what was on the video. Number 3, make use of checklists. Checklists are making sure that everything that you need and everything that is necessary is available for the procedure at the time that the procedure is going to be performed. I got the idea from my wife. When we would go on a trip, she had her own checklist for what she needed to pack in order to take the trip. And you can only imagine how our vacation could easily be ruined if my wife didn't have her hair dryer or her rollers. The concept of the checklist was instituted by Dr. Atul Gawande from Massachusetts General Hospital, a wonderful book called The Checklist Manifesto, and this has now become what's called timeout in the operating room. I'll give you a true story about a patient who was to receive testosterone implants, and he was on Coumadin, told to stop his medication, and the implants were performed without discontinuing, to be sure that he discontinued the use of the anticoagulant, and you can see what happened on the next slide. Therefore, as a result of this situation, I created checklists for procedures that were done in the office. These are the office procedures that have checklists, and here is an example of the vasectomy checklist. And as a result of that complication, the first issue to be discussed with the patient by the nurse or medical assistant, rooming the patient, asking them if they discontinued all aspirin, blood thinners, or anticoagulants. Take-home message on checklists is that they're routine in the operating room, and they can be used in the office setting, and it will significantly improve the efficiency of the practice. Education and patient satisfaction is number 4, and your compensation is going to soon depend on patient satisfaction. There are wallboards that you can put into each exam room that describes various procedures pertinent to our urologic specialty. They can educate patients, not only the patients, but the family, and you can use them for the most common urologic conditions. And here's an example of me explaining a urolift procedure to a patient and his daughter. You can draw on them with any color that you like. Here's an example showing the vasectomy procedure that is done. Again, you can use your finger or a pen, the blunt end of a pen or an eraser, to draw on the diagrams, the anatomical diagrams, clearly demonstrating to patients what you have in mind. These Wallboards also come with a kiosk in each exam room that can be used to show your videos, and you can survey your patients at the point of service, resulting in increasing your online reputation as well as patient satisfaction. These are available from outcomehealth.com, and they at this time are free because they receive funding from pharmaceutical companies. And finally, number 5, here's a low-tech technique for managing the pharmaceutical representative. They come in and they often want to have a prolonged discussion. I have an hourglass that I flip over when they come in and we start our discussion. I never say a word, I never make a comment, but I let them know that they're on the clock, or in this situation, on the sand, and that they have to move along their discussion and make it brief, as the longer 15 to 20 minute conversation with a pharmaceutical rep or a vendor is no longer possible. In summary, efficiency is vital to the success of a urologic practice. We can control and we can improve the efficiency of our practices, and as a result, increase our productivity and hopefully be home for dinner. If you have any ideas regarding efficiency and you'd like to share them with the Grand Round Urology community, please let me hear from you. If you would like my white paper on efficiency, let me hear from you. Or if you would like samples of scripts that I use for my videos, I would be happy to share them with you. Thank you.